difficult challenge. We would rather not have it go in and do the right thing to begin with, because remember, once you put it in, you then create an expectation in folks' mind to say, oh, now this is going to happen, I'm going to receive this or receive that, and we all know that those sorts of programs are very, very difficult once they get in to repeal. But yes, it absolutely can be done.
Can you get a
copy of the Republican bill on your website?
It's House Bill 3400, and we'll put a link on our website. Yes.
The Republican proposal is a substitute amendment to the Pelosi bill. The amendment will be offered by the Republicans if it is made in order, on the House floor. It will strike all of the Pelosi bill and replace it with the Republican bill.
We'll get out of rules.
That's our legislative team to offer the amendment when it comes to the House floor. I will check on HR 3400. I'm not familiar with that. But the way we are moving this on the floor is for a substitute amendment to the Democratic bill.
So we'll put it in to replace that, so it would become the new 3200. But we'll make sure we put a link. Jamie, can we put a link on the website to the text of that? So if y'all want to go to our website, www.wittman.house.gov, you can find that information there, the text of the Republican alternative to the Democrats' bill.
Can I suggest an argument that may appeal to your Democratic colleagues? I don't think they realize the unintended consequences that this might be the end of spending. Anybody who gets turned down or rationed for government health care is going to be PO'd when they see the other spending. You know, if I don't get my hip replacement, I'm going to be mad when they spend $10 million on a sex line.
That's right.
Well, that's a great point. You know, with all the excessive spending that's gone up here, and I mean, it's totally out of control. You know, you're talking about a tremendous amount of new spending with this, and if these projections as far as where they're going to save money don't come in, it's going to cost even more. So there won't be anything such as free health care. It'll be health care with more taxes, with more fees. So there never is free lunch. In this case, there never is free health care.
Will portability be addressed in the Republican?
The question is, will portability be addressed in the Republican bill? Yes, it is. Pre-existing conditions and portability are addressed there to make sure that you aren't denied access to health care or health insurance because of pre-existing conditions, or that you can take the policy with you wherever you go. Your policy is your policy.
Does it open up the availability of being able to choose health or insurance companies that now we're limited to?
Yeah, the question is, does it open up the availability to choose health care and to be able to buy health insurance across state lines? And yes, it does. It opens up health care insurance markets to where you can choose where you get it from. There's more competition.
Medicare fraud is, by conservative estimates, according to 60 Minutes, is $60 billion a year. It's Alice in Wonderland to even be discussing this when you have a program and total Medicare expenditures annually, Congressman, or
What would you say?
total Medicare expenditures annually. What's the number currently at?
You know, I don't know the number currently. I know that there are about, Jamie, I think it's about 30 million people that are covered or they're eligible for Medicare. I don't have the total.
That's around 460, 470 a year, 470 billion a year. So that's about a 15%.
15%.
And we're going to trust, given those facts, well established, that government should even be contemplating this. No private sector business would ever allow that amount of leakage, for lack of a better term.
Well, I would agree. And you know, a significant part of this bill, too, is a reduction in spending on Medicare. Upwards of $400 billion, depending on what the projections are. And then you look at that, where's that going to come from? There are going to be a number of significant cuts. If you're on Medicare Advantage, that's going to be taken away. They're figuring in a significant amount of savings, like you said, on Medicare fraud and abuse. Well, if there's that much savings there, why hasn't it accrued, or why haven't we gone after it to this point?
I probably asked a dumb question anyway.
I mean, why are we waiting now with the healthcare reform bill to get this done?
How many uninsured people will become insured under the Democrats' bill?
The question is, how many uninsured people will be brought into the system under this bill? The estimates are about 30 million under this bill. Now, the question then becomes, if those people are right now without health care, that is, they don't go to a doctor, if you're going to roll them into the system now, the question is where the provider is going to be to all of a sudden now see 30 million new patients, where we already have shortages of primary care physicians right now. So that already creates another challenge and another problem. Most of them. We serve on the Republican Healthcare Solutions Committee, and in fact, a lot of the proposals that have come in the Republican plan are actually ideas that were spawned right in the first district. So a lot of those ideas that are in the Republicans' plan for a substitute to the Democrat bill are almost exact to the 13 points that we have on our website.
What's going to motivate our clients to go to medical school? Exactly. And enter the medical profession.
Well, that's a great question. The question is, what's going to motivate our children to go to medical school? I can tell you, a lot of physicians out there are telling us that they're telling kids that are thinking about going to medical school to reconsider that if this bill goes into effect. Because, you know, I had an opportunity to talk to medical school students at the Eastern Virginia Medical School, University of Virginia, Medical College of Virginia. I said, what would it take to get you to go into general practice, which is where we have a shortage? What would it take? Would it take giving you full forgiveness on the amount of debt that you have when you get out of college, which for a medical school student getting out of a public school is about $140,000, or would it be to make sure that you got reimbursed at a proper rate so you can keep the practice open? And almost to a person, they said, you know, it'd be great if you forgave our tuition, but we don't mind paying off our tuition. What we want to make sure is that we get reimbursed properly. And you know, this system going into place is not going to put in place a system where a good, bright young person says, I can see myself practicing medicine and running a business or practice as a business and being able to keep the doors open. So that's the most fundamental thing. And I don't see kids who are pretty smart these days saying that's where I'm going to go. Yeah, and a lot of them are going into veterinary practice or dental school. You're right.